there are about 1 crore deaths of because of hypertension every year all over the world.
Hello, doctor. Welcome. Thank you so much for joining me here on my channel, Psych-o-jelly.
Hi, it's a pleasure to be here with you today.
Thank you so much, doctor. Today, I've recently heard that hypertension nowadays is a very common topic. Um, Many people do not know about it, but many people are facing hypertension, although they are unaware about it. So, I wanted to discuss it with you. But before I begin, could we please know a little bit about you? Could we please tell our audience a little bit about you?
Yeah, I'm a consultant physician and I've been practicing for more than 3 decades now in Ludhiana. I was initially at CMC, but now I have my own practice at Sravanagar.
Thank you so much.
And I'm more interested in prevention of diseases rather than treating them.
Thank you so much, doctor. My first question is, what exactly is hypertension and how does it affect people?
See, that's a very important question which you've asked. Hypertension is now one of the leading uh, diseases of the world, and it is one of the modifiable diseases. A lay stress on modifiable disease because it means if we take care of certain things, we can prevent it. And how do you define hypertension? For laymen, uh, we define hypertension as when a patient has a blood pressure reading of more than 140/90 on two different occasions, separated by some time. And if these readings are there twice, your doctor will label you as hypertension. Now, why is it important? That is also very important to know. See, there are certain figures which I would like to give you. Do you know there are about 1 crore deaths of because of hypertension every year all over the world? And more important is about 25% of heart attacks occur because of uncontrolled hypertension. And one third, that is nearly 30% of strokes, जिसको हम paralysis या लकवा कहते हैं, it occurs because of uncontrolled hypertension. And to make things more scary, every third Indian adult is in hypertensive, which is a huge figure. And to top of it, more than 50% don't know they are hypertensive. So that means out of so many adults who are hypertensive, 50% are not aware they're hypertensive. And make things even more worse, according to a WHO report, only 10% of hypertensives are controlled. That means if there are 100 hypertensives who are on treatment, only 10% are controlled. And that is a very low figure. And why is it important? As you said, see, the importance is it causes a lot of complications.
Okay.
So you want me to tell you about some of the complications?
Yes, please.
See, it is responsible for, like I said, heart attacks. It is responsible for paralytic attacks. It is responsible for kidney failure. It is responsible for, if you have blindness, it's a very important cause of blindness and even sexual dysfunction. So all these things occur because of hypertension, and we can easily avoid them if we control the blood pressure.
So, is that why it is called the silent killer? Because so many people are not aware of it?
Yeah, you brought in a very, very pertinent question. It is known as a silent killer because majority of hypertensives don't know they have hypertension. Reason for this is this usually has no symptoms. See, we normally talk about, कि मेरे को सांस चढ़ गया, मेरी दिल की धड़कन तेज हो गई, मेरा ब्लड प्रेशर चेक कर दो आज. ये घर में आम होता है. फादर घर आता है, बेटा मेरा ब्लड प्रेशर चेक कर दो ऑमरन मशीन से, क्योंकि मेरे को लग रहा है सिर दर्द हो रहा है. But that is a misconcept people have. Most of the times, patient is asymptomatic, and usually there are no symptoms. It's only when you have complications like heart attack, heart failure, or paralytic stroke, or blindness, one realizes you're hypertensive. Many times, I get patients A patient comes for his blood pressure check, and the person who's sitting next to him says, "Doctor Sahab, mera bhi blood pressure check kar do." And when I check, I find the person who has come just like that, his blood pressure is higher than the patient who has come. So it is very important to realize hypertension is a silent killer, and it should be diagnosed early so that we can prevent complications.
And like you mentioned, the blood pressure, what is the range of the blood pressure? Like that is, if you have that specific above or below the range, you're hypertensive.
See, according to Indian guidelines, there are different guidelines in the world, but according to Indian guidelines, if a person has more than 140, 90 on two different occasions, as I mentioned before, then he would be labeled as hypertension, as hypertensive.
Yes. Okay, thank you so much, doctor. And mm, like you said, we are not, sometimes we are also asymptomatic. So is there any still way to prevent hypertension before, like having hypertension, some preventive measures, or maybe after you have some like measures to control hypertension?
I think that's a very important question you asked. See, like I said, this is a lifestyle disease and it is modifiable. Meaning, if you take certain precautions, you can prevent hypertension, and even you can be off medicines if you take due precautions. So, the few things which must be stressed. First is you must lose weight if you're overweight. And this you can do by eating healthy. That means you should avoid sugar, you should avoid salt, unnecessary fats, and at the same time, take a lot of green vegetables and fruits. Besides that, it is very important to exercise for at least half an hour every day. One should incorporate that in one's schedule. Plus, if someone smokes or drinks alcohol, he should stop it. It is important to bring down the BP numbers. Then, another important concept which has come in recently is lack of sleep. Now, this is a common factor which is affecting especially the youngsters. Most of the youngsters sleep late in the night or get very little sleep. So it is recommended one should get at least 6 to 7 hours, preferably 8 hours of sleep every day, so that you can bring down your BP numbers. Then another important component is stress in today's world. So one should get the stress down. And if you do that, you can easily bring down your BP numbers. I've seen many patients who have done this. They've been able to stop their medicines also.
I myself, as a youngster, can confirm that yes, I agree that we do sleep late or have like little hours of sleep. But talking to you today, I think hypertension is very important and needed to be controlled. And like you said, sometimes it does not revert, like reverse. So like if you have hypertension, not most of the times you can get back to normal. So I think following all the preventive tips you've mentioned here are very, very important. So I think everyone who's watching the video today can gain something from this and maybe make small changes in their lifestyle to uh, prevent themselves from being hypertensive. Thank you so much for sharing these tips with
Can I
us.
just add something? Can I
Yes,
just
yes.
add something? See, other thing is which I must emphasize now. Sometimes lifestyle change cannot bring down your blood pressure to normal, and at that time, one should not hesitate to go to a doctor. And if he starts medicine, it is wise to start the medicine so that the blood pressure is controlled. You know, many times people are hesitant of starting medicine, but don't be hesitant because if you don't start medicines, you'll probably land up with eating 10 medicines after some time because of the complications. So if your blood pressure is not controlled on lifestyle, then please start medicines under guidance of your doctor. And I think you brought up a very, very important topic. I'm so glad we talked about it.
Thank you so much, doctor. It was really good talking to you. In part two, I hope we can bust some myths about hypertension that many people have, maybe about blood pressure and hypertension too.
Sure. Thank you.